Hello and welcome to Keep Talking, a community dialogue about mental health. My name is Gay Maxwell and I am the manager of the Office of Continuing Education at the Brattleboro Retreat. The Brattleboro Retreat is a 185-year-old addictions treatment and mental health hospital located in southeastern Vermont. It treats adults, adolescents, and children in a variety of inpatient, outpatient, and partial hospitalization programs. The Brattleboro Retreat provides care and courage when being human hurts. Today in our studio, I'm lucky to have one of our own, our very own Kurt White. And when I say that, that means that Kurt White is the Senior Director of Ambulatory Services at the Brattleboro Retreat. He's also the past president of the Vermont Association of Addiction Treatment Providers and a fellow of the American Group Psychotherapy Association, adjunct associate professor of Smith College School for Social Worker. So you're both a clinician and a teacher, and actually on Friday of this week you're going to be making a presentation through the continuing education program. So welcome and thank you very much for joining us. I know this is a piece of time that you're giving to us, and I really, really appreciate it.
Thank you for having me. Yeah, looking forward to it.
Good. Well, as you know, I felt like at this time where the landscape is changing tremendously when it comes to cannabis use or marijuana or pot, as I called it in my generation, that the landscape is changing. There's greater acceptance of cannabis use. It's legal in 12 states now and Washington, D.C. And so I wanted to have a conversation with you, mostly because this thing happened to me, this story, and I'm going to start this off with a story. I was privy to a conversation between two young adults, I'd say in their early 20s, and one of those young adults was inviting the other young adult to a harvesting party at her family's home, and that family had grown the legal number of pot plants that you're allowed to grow in the state of Vermont, and they were going to have a harvesting party. And this harvesting party was going to involve their young adult child plus two children that were under the age of 21. And this kind of made my heart, maybe my head and my heart sort of turn upside down because it's a whole different axis than I'm used to. And I thought to myself, wow, what does that mean for families? It's certainly not anything I experienced in the 1960s, and it isn't even something I experienced as a mother raising children in the 90s and in the aughts. So I thought, I'm going to ask Kurt, who's had all this experience as an outpatient and inpatient substance abuse treatment provider. What do you think about that particular scene? Is there anything that concerns you or doesn't concern you about it?
Well, it's a real sign, isn't it, about how things have changed. I mean, Vermont is perhaps a bit of an outlier with respect to the other states, although there is a trend going on nationally towards a greater acceptance and permissiveness of use, normalization of use of cannabis, of both adults and adolescents, actually. Although Vermont is a bit, like I said, more on one side of this continuum. We're the number one state for a total use of marijuana, and also the number one state for young people using marijuana.
Number one?
Number one. And we have been for quite some time, but even in Vermont, the trend is toward more people using, and those who do use using more frequently. And to me, those are some troubling trends, because I think well, this is still a very powerful psychoactive drug. I think sometimes in the conversations about it, we can forget that and imagine that it's just sort of like a very benign substance. But actually, anyone who's used marijuana in the last 10 years or so knows that it's really quite potent at the
How
moment.
is it different? You're saying in the last 10 years or so. How is it different?
Well, in 2016, I think they did some studies that showed that compared to marijuana, even just in the 1980s, that the active ingredient, the active ingredient that most people care most about, THC, is concentrations of about 4 times greater than the average in the 1980s. And so it's a much stronger drug now, much of the time. I'd say even since 2016, I would say there's probably a trend toward greater potency, partially because some of what people can buy in stores is actually quite refined, potent product, in states like Massachusetts that have a legal marketplace, for example. And also because of trends toward kinds of use of product that is perhaps more concentrated, this sort of oils and dab, as they sort of say, the sort of waxy-like hashish oil kind of substance that you can get, and that's certainly even more potent than even the more potent stuff that I was just talking about.
Why do you think there's this? There seems to be an overriding myth that it's not dangerous or it's not as powerful. Why do you think that is still part of our thinking or the culture's thinking?
Well, I think the trend toward the medical marijuana movement has kind of confused, I think, a lot of the dialogue related to this. Medical marijuana, for perhaps some narrower group of people with relatively significant medical problems that under the supervision of a doctor, is something that many states now have decided to permit. Now to call it medical is still a little bit funny to me, because it's usually with medicine we know how much of a dose to give, we know how often to give it, exactly how much is helpful and how much is harmful, and we don't have those answers for marijuana yet now, even in instances where we have called it medical marijuana. That isn't to say that for some people maybe it's not something that might benefit them, but it tends to be a relatively narrow group of people with pretty significant debilitating or problematic conditions. But I think to call it medical is one thing that changes people's perceptions about it, because that has a sort of a favorable, positive quality to it. It's actually part of the way that we got into such trouble with the opioid epidemic, actually. It was very relatively few people using heroin, but when we had heroin-like products that were pharmaceutical and medical and had those uses, a lot more people were introduced to using it, and also more people had a favorable overall view of it and a decreased perception of risks associated with opioids. And I think a similar thing, although they are very different drugs, a similar thing has happened with cannabis, I think largely related to medical marijuana.
So what do parents need to know? Now you're saying that it's much more powerful than perhaps people who are parents experienced in their own experience. What else do they need to know about marijuana at this time?
Well, I think if you're talking about young people using, I'm worried about that. I'm not as worried about adults using as I am as children and adolescents. Partly because the what we call the endocannabinoid system, the parts of the brain that the cannabis is working on when we take it in, when we ingest it, it's a complicated system in the brain that we're still learning a lot about. But it seems to have to do a lot with functions in the brain that have to do with neurodevelopment, with the brain that isn't totally fully formed yet. And there's still quite a lot of brain growth going on until you're about 25 years old, believe it or not. You know, we used to think it was mostly around 21, but further research has said...
And it's supposed to be a fairly tremendous amount of brain growth that's going on at that time.
It is. It's a very important time of life. And so there are risks associated with using it during this period of time that don't seem to be as prevalent if one starts using it later on, once they've reached full adulthood.
So that's a point that you feel like parents should know about, that this is something that is probably not great for their kids to be using up to age 25 even.
Yeah, I would say that's true. And every bit that you could get someone to delay using would be good, you know. And so using it, if you could get them to delay until 18, that would be better than using from 13 on, quite a lot better. And if you could get them to delay until 21, that would be better than 18. So it's not an all or nothing kind of game. But if it were me and my brain, I would want to take really good care of it until I was probably at least about 25 years old.
Is there anything else that you feel like parents should know about this drug?
Yeah, well, some of the risks associated with using early on, especially using regularly early on, one is that you're much more likely to develop addiction to the drug. Now, of course, some people have a misperception about it, that there is no such thing as addiction to cannabis, and it's not true.
That's a myth?
It's a myth, absolutely. It's really quite clear that there is such a thing as addiction, and most of the folks that develop it probably develop it during adolescence. That's actually a time when the brain is uniquely susceptible to developing addictions, not just to marijuana, but to other drugs as well. And it seems to be about 15% of people that use it will develop addictions, which is a very similar percentage to how many people will go on to develop addictions to alcohol. So it's not most people, but it's not a trivial number. I mean, 11, 12, 15%, depending on the study, is really quite significant.
How does that compare to alcohol? Do you have a percentage that you can pull out of your head?
Alcohol is usually clocks in around 11 or 12%.
Okay.
Yeah, and this may be in that ballpark, maybe a little bit higher. I wouldn't insist on that, but it's definitely very comparable to alcohol.
So the risks are kind of equivalent, really.
Risks are equivalent.
If your child is either using one or the other.
That's right.
It's risky behavior. No matter what.
That's right. Risky behavior no matter what. And right now I think, and so one risk is that you can develop compulsive use, addiction, a use that gets out of control, becomes more important than other things to the...
Yeah, well, I was going to ask you, what does it look like? What does it look like when somebody is addicted to marijuana, for instance?
Yeah.
Not for instance. What does it look like?
What does it look like? Yeah. Well, I mean, it could look like different things. You know, addiction doesn't just sort of have one face with any drug, but the usual hallmark of it is compulsive use sort of that you feel, that a person feels almost compelled to do. You have to do it. You can't get through the day without doing it. Maybe not just once, but multiple times, where you're sort of being pulled along to do it. That happens because of some very particular chemical processes going on in an area of the brain called the mesolimbic dopamine reward system. Wow. Your brain kind of gets hijacked into thinking that you need this substance more than you need any other thing. And when that happens, other sorts of activities that were perhaps more important to the person might fall away, or it might get in the way of friendships or relationships. It might start to cause other negative consequences in school or in a family setting.
Why do you think people have this idea that they can't get addicted to marijuana? Where does that come from? It's confusing to me, because I had that same idea too until I started doing some reading about it.
Oh yeah. Well, I think in some ways the messaging about marijuana from a sort of public policy level hasn't always been really totally clear. I think there was a kind of a one-size-fits-all approach to drug education in the 70s and 80s that sort of equated all drugs as alike. You know, your brain on drugs is like a frying egg in a pan or something like that. And but what do we mean by that? Does that mean cocaine is the same as heroin, is the same as cannabis? And I think, well, no, that they're actually quite different drugs. They operate on some parts of the brain very similarly, but some of the things they do to you are not entirely equivalent. You know, heroin is a risky drug in terms of your sort of your life. Every time you would inject it, for example, you know, you're taking your life into your hands. Cannabis, we wouldn't say that about, right? It's not that same sort of thing. Alcohol, we wouldn't say that about. So there are differences, and I think historically some of the policy approaches to risk didn't always fully appreciate the differences, didn't get the message out about what the real risks were.
Speaking about getting the message out, do you have some voodoo after all these years of working with I'm certainly worked with a lot of adolescents and young adults. How does one, and I ask this for parents, how does one get one's children to listen about this? Is there a technique?
Well, I think to be curious about what your children are doing and what they're exposed to. If you're a parent in this day and age, it means your children are very likely to be exposed to peers using marijuana, and that I would try to introduce that as a subject of some concern.
How early should you start talking to kids about it to introduce that?
Yeah, well, certainly in the middle school years, I would say, is often when people will start to have the first exposure to it among peers. You know, many people start to use as early as 12 or 13 years old, and so it's likely that you'll be exposed to peers using at that time. And so before that would be what I would say, before that, to at least introduce the subject to them. And I think to express real concern as a parent. And I think parents that take an active interest in their children's lives and what they're doing, those kids have a real advantage among parents that just kind of look the other way and act like it's totally normal, actually. Because I think there are risks associated with this, and silence can be a powerful negative message that sometimes parents can say out of fear of not saying the right thing. So I think try to say something, and try to keep a dialogue open, not just once, but in an ongoing way about what the environment looks like.
Getting back to my original story, I have some questions asked for parents who they might smoke themselves, and because it's legal now, it's not legal for their kids, but it's legal. What do you tell parents who smoke themselves at home and that their kids see it at least or smell it?
Right. Well, I mean, one could think that we do have some experience about this with alcohol, you know, that there is a difference between parents using and kids using. There's a difference between using a little bit and using a lot. There's a difference between using frequently and using infrequently. And I guess I would try to say, if parents can put some boundaries around it, put some limits around it, so that this is something that they're not always exposing their children to, in terms of them seeing them using or seeing them impaired from using, then that would be good. And some real clear idea that this is something that is not necessarily safe for them, even if it's something that their parents do some of the time, right? We try to draw that same boundary culturally around alcohol, and similarly with alcohol, we try to delay people initiating use until people reach full adulthood for some of the same reasons, because people who use alcohol in adolescent years before 21, maybe even 25, have a significantly increased risk of developing addiction to alcohol. With marijuana, by the way, there are other risks of using. In addition to just developing addiction. It seems like it interferes with memory and concentration and cognitive ability, and even some studies that suggest that people who begin using and use regularly under the age of 18 in this study it was 18, seem to have a decreased IQ, total intelligence, even as adults 20 years later. And so it might be interfering with the cognitive parts of the brain in irreversible ways as if people begin to use regularly as an adolescent. So some of the messages is delay using, much like we would have with alcohol, that hey, this is a substance it's legal in Vermont, at least on some level. There's not a regulated marketplace yet, but there is in Massachusetts. And people are going to be exposed to it one way or another, and I think people ought to know that it's not good for you as a young person, and that even as an adult, it's better if there are some really clear, firm limits around use.
Should parents smoke in front of their kids? What do you think?
I would advise against it. I would advise. I do think that the more that we telegraph the message that this is a sort of a safe and totally normal thing to do, the more kids will get that message and are more likely to try and experiment and less likely to put limits on it themselves. This has been established over and over again, that perception of risk, as people have less perception of something being harmful, then they try it more often and use it. Right? I mean, it's kind of common sense almost, isn't it? But
yes.
I mean, we've researched it also. We know that that's true, specifically with marijuana. So,
and my understanding is as well, speaking of risks, before I've had Stanley Posick from the Yale School of Medicine on, and Ron Powers, who's an author who wrote a very touching book about his children's experiences with schizophrenia, and Dr. Posick has spent his whole life working with people with schizophrenia, and they were quite adamant about the dangers of pot use for people who have mental health vulnerabilities, and I wonder if you could say a little bit about that.
It's true. And again, this is one of the risks that's most pronounced during the adolescent years, but may continue even into adulthood. That it looks like some people are uniquely vulnerable, probably for genetic reasons. Of course, we don't know who those folks are, right? Because we don't know. But some folks are uniquely vulnerable to exposure to marijuana triggering schizophrenia developing. And now schizophrenia is a really significant mental health disorder that is potentially a lifelong, life course altering kind of struggle for people, where people have hallucinations and paranoia and sometimes confused or delusional kinds of thinking. We do have medicines for that, but much better would be to prevent the development of that disease at all. Now, there aren't that many things that we know for sure can help to prevent it, but at least in some individuals, if they had not been using marijuana during the teenage years, we think that it could conceivably be prevented.
Can marijuana actually bring on psychosis? Is that?
It can bring on psychosis in like a transient way, but sometimes using too much, or using some of this very powerful new substances, or some people are just sort of constitutionally vulnerable to it having a kind of a psychotic response to it. Sometimes also using edibles, which tend to be more potent and longer at lasting. That all of those things are causes of emergency room visits for cannabis, essentially intoxication or overdose, that are becoming more frequent in this country.
I've heard there's also a certain group of people where inhaling marijuana is like inhaling an anxiety attack, that it can bring on great anxiety. It can.
It definitely can bring on some anxiety, sometimes very intense anxiety in some individuals especially. In fact, it seems like the research that I've seen suggests that again, there's so much we don't know about dosages and things like that some people say, well, it might be very helpful for anxiety. Maybe, but in very, very low dosages. Or it might be one of the other constituent chemicals in smoked cannabis, which is a CBD, cannabidiol, which is in a kind of a different legal status than THC, even in other states where THC isn't legal. That might have an anxiety-reducing effect and doesn't produce the same sort of high that THC does. But very often, THC does increase anxiety rather than decrease it. Although paradoxically, it can also give the person a kind of a positive feeling about things that makes them feel as if they were less anxious, even though they're not really. So an example would be someone I worked with some time ago said that that smoking pot was the only thing that helped her anxiety, and yet she almost never went out of her house because of anxiety. And so those things are inconsistent, and actually it was only later on when she stopped using for other reasons that found that her anxiety got a lot better, and said, gee, I thought it was helping with anxiety, but actually it was making it worse, and I didn't know it. And I've heard that story from quite a few people.
Interesting.
Yeah. Someone said recently, it's a drug that covers its tracks, and that's interesting. It makes it hard to understand always the effect that it's having on us.
So it may be very difficult to understand when you have gotten addicted to it.
Yes, or are on the road to addiction.
To addiction, yeah.
I think also the lack of social norms around it in this time of intense change is really significant, even compared to alcohol, for example. I met last week with a group of doctors, and we were talking about this, and they said, but with alcohol, at least people know that they're supposed to wait until the evening. But with pot, it's like people maybe don't have that same norm. And they say, why is that? And
Well, it's like smoking a cigarette.
Well, that was what they said, yeah.
It becomes like smoking a cigarette, which in the morning
That's right. So we would worry a lot about somebody that woke up and had a drink, or had to have a drink. But someone who wakes up and has to have a hit, maybe people aren't as worried about that as they should be. I would take that as a sign that perhaps the use is becoming compulsive, that the person is losing control of their ability to set limits on it.
It's interesting that there's so many parallels about the misuse of marijuana and the misuse of alcohol. It's interesting.
That's right. And I don't want to sometimes people listen to this and they think that I'm saying nice things about alcohol, and I don't have a lot of nice things to say about alcohol. I'm very worried about that too. It's a very powerful drug that causes a lot of damage in society.
It's a risk to the job you do.
Yes, that's right.
To worry a lot about these things.
That's really true. So maybe another time we'll talk about alcohol and some of the. We should still keep our eye on that as a profound social risk. But there are many parallels here, and I think one that I'm happy to sign on for is that most people who use it don't get addicted to it, but some do. And some that don't get addicted to it are still harmed by it, right? You can drive drunk once and have a terrible consequence, right? Similarly with cannabis, or you could use and have a negative reaction that sort of alters your life, or in the case of cannabis, it could bring on a problem
and this
like
is why it's so important for
right.
parents to keep those communication lines out and keep those communication lines open and pay attention to what their kids are doing.
That's right. The kids I worry most about are those whose parents are not talking to them about this, or who kind of have a feeling that, like, because we can grow cannabis in the backyard or in the basement, that it doesn't still have some very real, powerful effects that might be different in the developing brain than in the fully developed brain.
So even my thought is, even if you are not sure what words to use, if you're kids are going to roll their eyes at you and stamp up the stairs or whatever. It's really important to bring it up.
That's right. They can roll your eyes at you anyway, you know what I mean? So it may as well be in the service of trying to talk about this.
Yes.
I don't think people should go in, angry and guns blazing. I mean, I think this is just, it's become a part of society now that people will be exposed to this, and probably many or most adolescents are likely to try it. But I do think that as parents and as adults, people representing the sort of adult world, that we ought we really have a responsibility to convey the accurate information about risks of use.
Where could people go for more information? Do you have suggestions for that?
That's a good question. The state of Vermont has some fact sheets about marijuana that are on the Department of Health's website. That might be a good place to start.
Post
we
that
could link to
at
that.
the end of
I believe
this.
the CDC also has some web pages related to that. Simple fact sheets that are sort of full of accurate information, especially related to young people. SAMHSA, the Substance Abuse and Mental Health Services Administration, a federal agency, they may even have some toolkits for helping parents to talk about this with children.
Well, we'll link to those at the end of the show so people know where to go, because that's sometimes it's just gathering the knowledge to have a accurate discussion. Kurt, thank you so much for coming today and spending your time with us. This is really great. I think there are a lot of parents out there who stumble around with this, and it's all new territory. It's really, really new territory, certainly for me, as I listen to what's going on and compare it to my own experience years and years and years ago. But I really, really appreciate your being here.
Thank you.
Thanks.
Thank you.
And thank you for joining us for another episode of Keep Talking. I would like to thank the Brattleboro television station for all the work that they do. Brian Bashaw, I couldn't do it without you. So thank you, and we'll be back again with another episode soon.